of health, both healthcare and public health services. Cities tend to have more availability of healthcare and public health services than non-urban areas, but not infrequently you have problems with access and with equity of access around advantaged and disadvantaged groups in cities. So if we can improve the physical environment, the social environment, and the health service, health access environment, we have a tremendous opportunity to improve health for urban residents worldwide, and by improving health for urban residents, we are improving the health for the entire global population. I wanted to make just a concluding comment about trauma and disasters in cities, particularly in light of the terrible earthquake in Kathmandu. The one thing that we know for certain is that there will be traumas and disasters happening in cities. We know that the number of disasters have been increasing in terms of number of people affected over the past 30 years. Now you might ask, why is that? Well, the reason for that is simple. We have more and more people living in cities, and more of our cities are in areas which are close to water, which are at high risk of natural disasters. So we know that these events are happening. And what's heartbreaking is when we do not invest the resources needed ahead of time to anticipate these events happening, to mitigate their consequences when they do happen. And I think we are seeing that in Kathmandu, where there has for years been discussion that this is an area that is at high risk for earthquakes. And that there are plenty of examples where large-scale traumatic events happen and very few people die. And then large-scale natural disasters happen and lots of people die. And the difference is typically not in the natural insult, but the difference is in how prepared we are. So in the agenda of thinking about healthy cities, it is critical that we invest in preparing cities so that they can mitigate the potential shocks. It is a difficult thing to do from a political sense, because the one thing we don't know is when a disaster will strike. And it is difficult to invest politically, not knowing if the yield for that is going to be tomorrow, next month, next year, or 5 years from now. But we do know that these events will happen, and it is part of building healthier cities to prepare cities for potential external insults. And I think the events in Kathmandu are a very sad reminder of the necessity of that. I will stop there. Thank you.